Hey guys, Dr. Derek Spence from Myofascial Mobility Systems. Today I shot two quick videos for you guys to check out. The first one being treating the lumbar and thoracic spine erectors with the M2T-Blade. And the second one is going to be kind of a continuation of that, being treating the traps, rhomboids, levator, and kind of the upper T-spine erector, same sort of area. Check them out. Hope you enjoy. Okay, so when we're treating the lumbar spine and thoracic spine, obviously a lot of things are going to kind of meld in between both of them. So all of our erectors are going to come in from the low back up to the thoracic spine, mid back. So we can kind of treat them all very similarly. So to begin with, we're going to do the same stuff we've done before with just a general scan of the area. I'm going to put some cream, some cocoa butter onto her back. We're going to use the number one edge on this side, and again, bring it down, nice broad strokes, feeling for any of those restrictions or adhesions that we feel in there. Like I said, we can almost feel right through the erectors all the way up to the thoracic spine. I'm going to stick to the lower thoracic spine, TL junction, lumbar spine on her right now. And when we find a good spot right in here, we're going to really start working that out. And I'm not really feeling a whole lot with it right now, so I'm going to flip it over, hit it up with that 55-degree edge, get a little bit deeper, and we can really start feeling those restrictions and adhesions through that area. It's perfect. The one thing that we really want to watch out for when we're doing this is that we don't have the blade right over top of her spine, so we're going to try and work on either just the right side or just the left side at once. So instead of trying to feel both, because we don't want to rock our way down and hit those spinous processes. So just sticking on this right side, we're going to work through. And like we've said before, with this, we've got to kind of move some skin slack out of the way if we need to, if we feel like some skin's just moving. And once we start seeing a little bit of reddening on there, we've probably done our job. We don't really want to bruise her or anything like that. Okay, and same thing, if we come up a little bit higher into the upper T-spine, lower C-spine, we're going to do the same idea. But as we get up in through here, we have a couple more muscles we want to think about. So other than just our erectors, which are obviously our more superficial muscles, we also have our rhomboids through here, which you can attack as well. To do that, I'm going to grab her arm with my hand, and we can kind of find those lines of tension and bring the blade through. Like always, we're going to start with that nice number one edge right on the bottom here. 35-degree angle, so the M2T logo facing up, and always keeping this at a 45-degree angle. With this, we can really find nice lines of tension when we bring the arm down and get that scap out of the way a little bit. And that's how we're going to treat the rhomboid up top nice and quickly. Again, there are quite a lot of restrictions up there, and we're seeing some quick reddening through that area. But we kind of attack this whole piece as one and find out where those adhesions are. If there's only adhesions down low, that's all we're going to treat, is these lower areas. But with her, we're finding a lot more up top, so we're going to continue to work through that and possibly move it on into her shoulder.